Better examples when we get to the left-hand side. Don't forget, this is a relatively low-pressure chamber, the right ventricle. So there we have it. There's the down to the apex. Look how thin, how thick the septum is. It's a huge, big, massive chunk of muscle. So tricuspid valve, cords. If we go down to the left ventricle now, you can see the closed valve there in the aorta. You see that? Cusps down there.
Oh yeah.
The valve looks as though it's in the closed position. So let's take and go down through the mitral valve into the, are you listening? Sounds like an episiotomy.
Don't really need that. I can feel it.
Now look at that. There's a few things I want you to notice here. Look, first of all, you can see this doesn't look smooth, does it? You know, this looks like you can see the muscle fibres there. But I want to draw your attention to this surface. You can see that there's a lining there, but the muscle fibres lead up to a sort of lining, and that's the slippery bit that we were feeling before. That's the pericardium, and you can see it's intimately attached with the myocardium. On the inside of the heart, we've got much more well-developed chordae, supporting this bicuspid or mitral valve. What I want you to feel now is the structure that the valve sits in. It's a sort. If you feel it, it feels kind of more solid and more fibrous-y than.
Oh, it feels like cartilage.
It feels almost like cartilage. Yeah, that's a good way of describing it. The muscle on the right-hand side was impressive to feel. There's one for the left ventricle. Yeah, a huge, big bean-looking thing. Yeah, and you can see how it will support, if it contracts, the cusps of the mitral valve, the bicuspid valve.
Are they the cusps in that just those little tiny bits there?
Yeah. Well, I'm trying to work one up, but it'll be kind of easier if we do it on the aorta, but. Considering they've got a whole blood back 80 beats a minute for 80 years of your life. But if we go up to the aorta and take a look at that, we should be able to see more in the way of proper preserved valve. And I'm lucky there, look, because I've just cut it in the right place. But you can see the sort of bag-like quality that I was talking about before. If I just put my scissors in there, look how delicate that is. I mean, just look. That's going to resist 120 millimetres, 80 millimetres of mercury, pressure per beat. You know, it doesn't look as thick as cling film. That's absolutely phenomenal. And if you see the engineering on a prosthetic valve, it's rubbish compared to that. You know, it's big and chunky and rubbish. That will allow your blood to pass over it, and then will fill up and stop regurgitation of the valve. But it won't damage blood in any way, shape or form. You know, it won't give you a sort of hemolysis. There, and there, you can see the origin of the coronary arteries.
Quite bigger than I thought it would be.
See that?
Yeah.
The origin of the coronary arteries. Can you all see that? Come forward. That's the origin of coronary artery disease. That's what keeping you all in business. So why don't we, while we're here and we've got it open, why don't we endeavour to cut open one of these coronary arteries?
But you know your VSDs then?
Yeah.
Are they tiny little holes through that septum?
Yes.
How big is tiny? Because when you used to hear it sort of holes in the heart and things, that's what they're talking about, isn't it?
They're talking about a hole in that muscle there.
Right. But they're very, very tiny, like pins.
I don't know. My guess is that they will vary depending on what's caused it. You know, for infants, I don't know. Adults, however big the infarct is that's produced it.
I can't believe how small the chamber is. I just imagined it to be bigger than that.
Yeah, yeah.
I knew it was small, but I didn't think it was.
So, left ventricle, while I'm here, left ventricle, right atrium. There's the right atrium there. Now somewhere in this, we've got it in front of us, so, you know, but somewhere in this is the cardiac sinus, which will drain the veins. Can anyone see it?
And is that where they go through to do the bivent pacing?
Yep. Is that it?
There.
Is that
Is
it?
there?
All I'm saying, my cases here is fairly simple.
Yeah.
It's hard to see. It's hard to see even when we've got the thing splayed open in front of us. Somehow or other, physicians manage to get poke that with a stick from the femur, right, and get a pacing device down it. So if you're not lost in amazement at that, let's just go down and we'll cut open. None of this would impress a pathologist, by the way. This dissection technique. I'm never going to get me fellowship at the Royal College. Right. Now there's the artery running down there, and I'll be able to expose it if I just squeeze some blood out. Can you see that? Look. It's from that, the coronary artery disease. Now you know, you obviously did sewing and knitting when you were at school, so you're ahead of me on this. But my guess is there wouldn't be one person in this room that would fancy sewing a bit of vein, yeah, onto that, even with a magnifying glass. You know, it's tiny. It's absolutely tiny, and bypass grafting nowadays, it's regarded as almost a routine procedure. It's so routine these days. They don't even stop your heart. The heart's moving away like that. And they're going, oh yeah, I'll last a bit of vein onto that, no problem whatsoever. Back to the ward, discharged from the intensive care unit same day. How? Any questions while we're here? Any questions or points?
When they're doing bypasses, they open the pericardium to get access, don't they?
Yes.
That remains an open book, doesn't it then? It's not sealed after the surgery's done.
Don't know what to do these
They used to
days.
staple them, didn't they?
Did they?
They used to staple down the front.
No, actually close the pericardium again. Did they close
I
it again?
don't know.
I don't know about that.
I don't know.
I don't know.
Because wouldn't that cause like a constriction and
I can't remember.
Yeah.
I don't remember.
There's your homework. There's your homework for this week.
Yeah.
Give Neville Rumsby a ring.
The patients used to say my heart feels as if it's beating much stronger now, but is it because they haven't got that dulling of the pericardium around?
It's holding it in place. That is the
Yeah.
function of the pericardium, is to stop your heart from expanding that much. I don't know what they do with pericardium. I imagine it's pretty tough to reseal once you've had the circular saw through it. Any more questions while we've still got this in my hand?